The Psoas Release, you have to be careful with this one as it is a hip flexor, attaches to the spine, so you can't go get it posteriorly, you have to go anteriorly. This requires a good informed consent from the practitioner. You're going to start a couple inches lateral to the umbilicus. Again, using that 2-finger grip, flare out your elbows to make it even. You're going to go in with your pads and not your nails. So you're going to go in anterior to posterior very slowly and slightly medial. If you feel a pulse, you have to go lateral to that because that would mean you're on the aorta. So in order to check whether you're actually on it, they even slightly lift up the hip, slightly flex it and relax. And that should not be an abdominal contraction. Abdominal contraction will kick you all the way out. Go ahead and flex your abdominals. It'll kick you out. The psoas contraction will not do that. Initially, you can strum it back and forth to release. Again, this is going to be very uncomfortable. You have to tell the patient that, their organs are just going to move out of the way of your hands, but you just have to push them out of the way. There's really no danger of rupture, and obviously if anyone had any kind of internal organ issues, hernia, or bleeding disorder, you would not do this. So some movement-based progressions for this. You can start with repeatedly elevating the arm. You can push in the opposite direction for that. Then they can progress to also heel slide. The heel slide then needs to leave the arm up, heel slide, and push in the opposite direction. Feel a stretch? Yes. Something a little less aggressive than a heel slide. You can drop into internal rotation and adduction, and I'm also going to pull in the opposite direction. I'll keep my depth and do that on and off. And lastly, everyone's favorite anterior pelvic tilt. Okay, just do that on and off. So while you actually do start by the umbilicus, you can progress your depth lower. You can also progress more superiorly, as the psoas actually has fascial attachments to the diaphragm. As far as the diaphragm and the bony contours of the 12th rib go, you can give a good diaphragm stretch by kind of hooking on it like a handle. Arm's going to need to be down for this to relax the abdominals. So when he takes a deep breath in, the rib will expand, and you hold it up while he exhales. Feel stretch?
Yep.
Okay, good.